The topic of lecture is dental instruments and equipment. Lecturer Dr. Lev Kilman. This lecture outline hand dental instruments topics, rotary dental instruments, attachments, endodontic instruments, dental equipment, dental units. Each dental hand instrument has a defined use in a dental procedure. The dental assistant is responsible for knowing what each dental hand instrument does and which one the dentist will need during a procedure. Most dental hand instruments are used to examine the mouth and teeth, to professionally clean the teeth, to cut the teeth cavities, to place filling materials, and to carve dental fillings. Most dental hand instruments are made of stainless steel, carbon steel, or plastic and must be strong enough to withstand constant use and sterilization procedures. The dental assistant should set up the dental hand instruments on a tray in order of use, in part to not delay the procedure. A procedure tray is set up from left to right. The dental assistant will use their left hand to transfer instruments to the dentist. Many manufacturers assign a universal part number to most instruments, and the dentist will often refer to the number rather than the name of the instrument. A dental assistant will want to learn the number and name of all dental hand instruments. Most dental hand instruments fall into 4 categories. They include examination instruments, hand cutting instruments, restorative instruments, and instrument accessories. Instruments that are used in operative dentistry include basic examination kit, mirror, probe, periodontal probe, and tweezers. Restorative instruments allow the dentist to place, condense, and carve the dental material to the original anatomy of the tooth structure. Basic instruments. There are few basic instruments that are universal to almost every procedure in dentistry. Classification of instruments. Hand instruments and rotary instruments. Hand instruments are for examination of teeth, for cavity preparation, for material placement, for material mixing. Rotary instruments can be slow-speed handpieces and high-speed handpieces. Structure of hand instruments. Working ends instruments are the functional part of the instrument. It can have a variety of functions, including cutting, packing, carving, placing, and condensing. It is adapted to the function of the particular instrument. Working end may be beveled. For example, working end is cut at an angle. An instrument can be single-ended or double-ended. It means that it has working ends on both ends of the instrument. Shank of an instrument, the part between the working end and the handle. So this is shank. It can be straight or angled. The function of the instrument determines the angle and flexibility of the shank. Handle of instrument, it is the part of the instrument that the operator grasps by hands. Examination set of instruments. Examination instruments are the most often used instruments on the dental tray. They allow the dentist, dental hygienist, or dental assistant to thoroughly examine the patient's mouth. These instruments include the brilled probe, cotton forceps, explorers, mouse mirror, periodontal probe, and straight probe. Mouse mirror is the initial instrument in the examination set of instruments. So the function of this instrument to provide indirect vision to the oral cavity. and to its organs. As well, it can be used to reflect light. For another function, it is retraction and protection of oral tissues. And finally, for magnification, the number of the mirror represents size of mirror head. Dental probe. This instrument as well belongs to the set of examination instruments, and the function of this instrument to provide detection of defective pits and fissures, to look for calculus, deficient margins of restorations, crowns and bridges and caries, to do examination, because these pointed tips of the probe allows good tactile sensitivity. Varieties. It can be single-ended or double-ended instrument. Many different styles available. It can be straight probe or it can be curved. Railed probe is used to detect the junction between the enamel and dentine. Periodontal probe. Function of this instrument is to measure the depth of periodontal pockets. Tip is calibrated in millimeters, as you can see on this photo. Blunt end, you can see this button on the top. Blunt end prevents from trauma of periodontal tissues. It can be available in such varieties: single-ended instrument or double-ended. It can be straight, curved, or at right angles. As well, plastic types are available. And this photo shows you how the periodontal probe works. Measuring of the depth of periodontal pocket is visible on this part of the photo. Depth of the pocket can be measured by this calibrated millimeters. And here's a normal, healthy level of the gum tissue. Tweezers belong to the examination set of instruments, and they have such function to pick up and to place some small objects in the mouth, to retrieve small objects from the mouth. Available lock-in type to prevent drop-in materials. Varieties: lock-in and non-lock-in types. Working ends can be straight, curved, as in these pictures, serrated and smooth. And you can see how the dentist pick up the cotton roll and insert into the oral cavity, and how the dental assistant or a dentist look for some small dental burrs, pick up them, and select the most appropriate by tweezers. Hand cutting instruments. They allow the dentist, dental hygienist, or dental assistant to remove decay manually from teeth for final restoration. The hand cutting instruments include the chisel, excavator, elevator, gingival margin trimmer, hand piece, hoe, hatchet, and scala. In this lecture, I mainly focus your attention on excavator, as this is instrument that is used for manual caries removal. The spoon excavator, this picture you can see. The function of this instrument to remove decay from the caries cavity manually. Working ends, the working ends, you can see small spoons. They are sharp enough to excavate decay. It is double-ended instrument, and working ends are bent at the right angles. Any remaining caries will be removed with the conventional handpiece and a round burr on the next steps of caries cavity preparation. Restorative instruments are used by the dentist or dental assistant to restore a tooth by placing, condensing, and carving a dental material to the tooth structure. Restorative dental hand instruments include the amalgam carrier, burnisher, condenser, composite placement instruments. The first instrument in this group that should be discussed is a flat plastic instrument, as you can see on the pictures. This is called flat plastic instrument or flat plastic, just. The function to deliver material to the cavity, to remove excess of material on the stages of material insertion into the caries cavity. Varieties of this instrument. As such, it could have various sizes and various shapes depending from the size of the caries cavity and the group of the teeth for which this instrument is intended. It can be single-ended or double-ended. Usually it is double-ended instrument. On one end is a flat plastic instrument and on the other end is a round-ended ball-ended pot. Functions and features of round-ended plastic. It is used to create anatomical shapes in composite material during restorations. The ball-ended plastic instrument can also be used to pack and condense composite materials, as it is seen on these pictures. Mixing spatulas. This is metal instrument, double-ended. It is used for mixing cement on a glass plate. Rotary instruments. So rotary instruments include the dental handpiece and revolving mechanism, which include cutting and finishing burrs, polishing tips and points, and abrasive discs and stones that fit into the handpiece. The combination of the two is a miniature representation of a power tool. Even though many patients identify the handpiece as a drill, you will want to educate your patients directly to make it sound less threatening. The handpiece provides power and rotary motion, whereas the dental burr, which is held securely in the handpiece, does the actual cutting or polishing. Handpieces and burrs have a variety of uses in restorative dentistry. The two most commonly used types of handpieces are the low-speed handpiece and the high-speed handpiece. So rotary instruments and their attachments. So you can see on this photo handpieces, high speed, slow speed contra-angled, slow speed straight, and a rotary mechanism micro engine for slow speed handpiece, and attachments that fits into different handpieces. So dental handpieces and rotary attachments help to make dental treatment more comfortable for the patient and reduce the amount of time needed to complete procedures. The first rotary instrument that should be discussed is the air turbine handpiece. It is also called fast handpiece, high-speed handpiece, air rotor handpiece. All of that are synonyms. Type of this instrument is contra-angled, as you can see. Functions, precaution, and features. So first of all, removal of tooth tissue during restorations and preparation of teeth for fixed prosthetic appliances, polishing of restorations, high speeds create heat and friction, so headpiece must be run with water to cool the tooth to prevent pulpal damage. So it is of critical importance to remember about this point. High speed saves treatment time and reduces vibration in comparison to slow speed handpiece. A high-speed handpiece is driven by a turbine. It may need to be lubricated, but prior to do anything necessary to check manufacturer's instructions. Compressed air rotates the turbine, which then rotates the burr. Speed. Usually, the speed of such type of handpieces is 500,000 revolution per minute. It accepts friction grip attachments and it is connected to dental unit. it is available in different types of tucks, those which need bird changing tool as well. It can be with or without light, and smaller heads for difficult access as well is available. Slow speed handpiece and straight handpiece in this slide. So functions of straight, slow handpiece. Used in surgical procedures to remove bone, it cannot use air turbine as the water is not sterile in that case. It is used extraorally at chairside or in the dental laboratory, for example, for denture adjustments. The speed of this instrument can run up to 40,000 revolutions per minute. It accepts long shank attachments, and it is driven by electric motor that fits into the base of the handpiece. Contra-angled slow-speed handpiece. The main functions of this instrument is to remove tooth decay together with burrs, together with stainless steel tungsten carbide burrs. As well, it can be used for polishing with special attachments, rubber cups, paper discs for polishing. And it can do some procedures that require torque. As well, this instrument can be used together with lentulospiral filler to do root filling, to provide root canal filling procedure. And this instrument, together with appropriate attachments, can refine cavity preparations and adjust occlusion. It is driven by gears, and the speed of the handpiece ranges from 0 till 40,000 revolutions per minute. It is driven by electric motor that fits into the base of the handpiece. Burrs, attachments. So dental burrs are essential cutters which are used with a handpiece with removable heads. The burrs are often made of diamond or tungsten carbide for strength. And let's go into structure of the burrs. Every burr has head, neck, and shank. Head, this is the working end. Function depends on the size and shape of the head. Many different sizes and shapes, each used for a different function: cutting, polishing, and finishing. Neck, the part that connects the head to the shank, usually narrows towards the head. And shank, it is the part that fits into the handpiece. Shapes and lengths vary depending on function, can sometimes be marked to identify burr type. That's why on the neck, or basically on the shank of the burr, you can identify some color strips. And actually these color strips, according to International Standard Organization, will inform dentist or dental assistant what is the size of the diamond grip on the working end of this particular burr. So this, you can see white strip, blue strip on the shank of the burr. Quick grid identification by color bands. So color-coded ring on all burrs were designed for quick grid identification. As you can see, different colors identify the size of the diamond grid on the working end of the burr. So white for finish, processing of fillings, yellow for processing and smoothing edges of composite fillings, red for finishing processing, blue for universal processing of the tooth, green for fast caries cavity preparation, black for fast cavity preparation, and it considers to be the most universal one that is fits into every clinical case and will remove the decay effectively. One more important statement about shank types. So we have straight tip, but pay attention to the length of this burr. Yes, angle tip as well. Standard length. Short, yes. Turbine tip, such lengths. And long shanked handpiece for turbine handpiece. Pay attention to this one and compare the lengths. Yes. So the burrs could be standard sized, could have standard lengths, and be long shanked to get access to that areas where it is hard to get access by standard shanked burrs. The long shanked is intended for compromised access gaining. Shape and function. Shape determines function. The examples that follow relate to tungsten carbide burrs. So we have round or rose head. It used to cut and remove tooth decay. Pear-shaped over here. So to shape the cavity preparation. Fissure, to shape and prepare the cavity preparation. Straight fissure, tapered fissure for polishing can be used. Inverted cone is used to shape floor of the caries cavity. Straight fissure to shape walls of the cavity preparation. At the same time, it can shape the floor of the caries cavity as well. So floor and walls shaping, inverted cone floor shaping, make it straight. And this gives you understanding, this picture gives you understanding of the different variety of burrs. Tapered fissure for polishing, rugby ball as well for polishing, tapered fissure for initial preparation, inverted cone for preparation. Green band indicates that this burr is used for enamel and dentine preparation. Black indicates rough initial preparation of enamel dentine. And a tungsten carbide is used to cut dentine, and they connect to the slow speed hand pieces. Round stainless steel burr, Fisher stainless steel burr is over here, fits into slow speed handpiece and can be used for cutting and removing of tooth decay. A grip and corresponding handpiece refers to the way the burr's shank is gripped into the handpiece. So here we have a grip for high speed friction grip shank and slow speed ledge type shank. Here you can see burrs for slow speed handpiece, for high speed handpiece, and in magnification view, the grip that fits into handpiece. Most ledge grip burrs are made of steel. Most friction grip burrs are made of tungsten carbide or diamond. Most long shank burrs are made from steel if they are meant for surgical procedures, and stainless steel if they are meant for laboratory purposes. Some points to remember about rotary attachments and burrs. Most often called burrs, but also available are wheels, discs, rubber points, rubber cups, and stones. Each has a particular function: cutting, polishing, finishing, or caries removal. They are made from various materials: tungsten carbide, diamond, and steel. They can have flutes, the cutting edges. The end of the shank determines which handpiece the attachment will fit into. A long straight shank, straight handpiece, a ledge grip, conventional type for slow speed handpiece, friction grip, will fit into air turbine handpiece and other various attachments such as snap or screw type attachments. We eventually go to the accessory instruments. So accessory instruments are miscellaneous parts and instruments that are used to complete a procedure. Some of the additional accessory instruments include air and water tips, articulating paper holder, retractors, matrix system, polishing items, and so on. So extra armamentarium, the first position in this list of extra armamentarium is matrix holder and strips. The matrix retainer holds the matrix band in the correct position and is an aid for dental fillings. The matrix band and the matrix retainer are used for interdental restorations. The matrix band is placed around the tooth and holds the filling material until it hardens. If there is no use of a matrix holder and a matrix strip in a second-class cavity, there is a possibility that material will flow into interdental space, causing problem with brushing the teeth, impossibility to use dental floss, and eventually this could lead to inflammation of interdental papilla and then gums, and possibly could lead to more severe problems leading to periodontal inflammation. And you can see here the position of matrix holder, Toffler-Mir, the most widely used, matrix retainer, Toffler-Mir, and matrix band fixed around the tooth to restore the proximal surfaces of the tooth. As well available another design of matrix retainer, ivory matrix retainer, such type. And this picture gives you idea of variety of matrix systems that are on the dental market. You can see the ivory matrix system, and another designs that are popular and can be used in the treatment of tooth decay, in the restoration of tooth decay. Polishing strips. They are made from metal or plastic. These thin strips have an abrasive side that can be used for interproximal reduction, contouring, or finishing the restoration. Different grids are available and some systems are color-coded to make it easy to identify the type of finishing strip being used. And you can see how it is done in the practice. Insertion of the strip between the teeth and polishing the interdental space of the proximal restoration. Here you have the description of color coding. So available colors indicates the grid, the size of the grid. So purple for shaping, blue for smoothing, green for pre-polishing, pink for polishing of restoration. Polishing cups. Dental composite finishing polisher silicone particle polishing head cup. Here you have. This is used to polish resin composite restoration. So this silicone carbide rubber polishing bars are for material removal, shaping, smoothing, creating a matte finish, and polishing to a high luster finish on resin composite. Such rubber polishing cups for cleaning and polishing of the tooth surface after dental prophylaxis. And variety of rubber cups, rubber disc, rubber point. Articulating paper holder is a diagnostic tool used in dentistry to highlight occlusal contacts and the distribution of occlusal forces. So articulating paper is fixed by this articulating paper holder and inserted into the oral cavity, and patient is asked to close his teeth in such position that he can chew and masticate. And after opening of the mouth, the dentist will see the high spots by discoloration of enamel with the color of articulating paper. Pinkish or bluish spots on the teeth will be visible. So in this way, identifies the high spots that should be removed on the stages of finishing and polishing of restoration. Moisture protection items. Saliva ejectors are for removing saliva and pulling water during patient care. High velocity evacuators are meant for specific uses during a procedure like crown preparation, extractions, and to help reduce the spatter and spray during dental hygiene procedures. As you can see over here. Dental cotton rolls are used to absorb saliva and other fluid to help keep operative areas free of excess moisture. These small rolls of cotton can be placed in a patient's mouth uh, at the outset. In general, to provide moisture control, should be used tips for high volume suction, low volume suction, cotton wools, rolls, or dry guards. Rubber dam, coffer dam, and Optragate. Dental practitioners vary greatly in their use of the dental dam. Some practitioners use them frequently. For others, they are only applied during selective treatments, whereas, whereas many choose not to use them at all. The rubber dam retracts and protects lips, cheeks, tongue, and even the gums. Retraction of soft tissue for better visibility. This also allows the dentist and assistant to focus more of their attention on your tooth and the procedure. Optragate is a latex-free lip and cheek retractor. The aid's unique flexibility and elasticity make it comfortable to wear and assist patients to keep their mouths open. Endodontic instruments. A variety of instruments are available for the extirpation of the pulp and the instrumentation, preparation, and obturation of the root canal. Although almost all these instruments were designed between 50 and 100 years ago, important changes have occurred in recent years with regard to their quality, efficacy, and standardization. Root canal instruments are available as hand instruments and many of them as engine-driven instruments. As new instrument systems are produced, new, new materials, new instruments evolve. And here I suggest you classification of endodontic instruments that were designed by Carson in 1996. According to this classification, instruments are grouped according to clinical use. And we have diagnostic instruments, root needles, Miller needles, pathfinder, instruments for passing, enlargement, and shaping the root canals, K-rimmer, K-files, H-files, instruments for removing the soft tissues, barbed broaches, instruments for obturation, lentulo-spiral filler, vertical and lateral gutta-percha condensers. Classification of endodontic instruments according to International Standard Organization are subdivided on such types. Hand instruments, here we have files, K and H, barbed broaches, spreader and plugger, vertical and lateral gutta-percha condensers, rotary instruments such as Gates Glidden drills, piezo-rimmer drills, rotary instruments, H files and K rimmers for slow handpiece, lentulo spiral filler, rotary paste filler, and pins, gutta-percha pins. Instruments for debridement and shaping of root canal. Chemical and mechanical root canal debridement are the primary methods used in endodontic therapy to remove all dead tissue bacteria and microbial byproducts from the canal. This task is accomplished with hand-operated instruments, include cut-type primers and files, broaches and headstrom files, and rotary instruments. It can be engine-driven. Rotary instruments are subdivided on such types. The first, Gates Glidden drills. So the function of this instrument to enlarge the coronal set of the canal during endodontic treatment. They are small flame-shaped cutting instrument used in the conventional handpiece. They have different sizes, coded by rings or colored bands on the shank. They are slightly flexible and will follow the canal shape but can perforate the canal if used too deeply. Should be used only in the straight sections of the canal. So here you can see the magnified view of this instrument. Gates Glidden. Piezo reamer drills. The function of this instrument to remove gutta percha during post-preparation. It is a small flame-shaped cutting instrument used in conventional handpiece, available in different sizes, coded by rings or colored bands on shank. Piezo reamers are not flexible or adaptable. If not used with care, can perforate canal. Nickel, nickel titanium, rotary and hand instruments. You can see over here rotary instruments and over here hand instrument. Niti files. They are used to clean and shape the canals, used with endodontic handpiece and motor or can be hand instrument. Niti is flexible and instruments follow the canal outline very well. Several varieties of systems with different sequences of instruments are used. Important to follow the manufacturer's recommended speeds and instructions for use. So another group of endodontic instruments, hand endodontic instruments. The first in this group is barbed broaches. So the functions of this instrument. It is finger instrument that is used to remove the pulp. They need to be used carefully as they can bind and break in the canal. They are available in different sizes and widths. And you can see these instruments grouped according to the size according to the colors that is can be recognized according to International Standard Organization color coding system, and magnified working end of this instrument. It looks like a small hooks on the metal blank. Barbed broaches is inserted into the root canal to the two side lengths of the root canal, then rotate 180 degrees and pull together with the pulp. One or two rotations should be done to catch the pulp tissue. The next group of endodontic instruments, it is files, K-reamer, K-reamer, K-file, H-file or headstrom file. K-reamer is used to pass through root canal. K-file is used to enlarge the space of root canal. H-file is used to shape the root canal, removing all irregularities of the wall. And according to International Standard Organization, all endodontic instruments have their geometric symbols. So K-reamer is triangle, K-file is rectangular, flexi-file is rhomboid, and H-file is a circle. Handles of endodontic instruments are colored by a certain color, and this color indicates the size of the tip diameter. And you can see on this table this color coding of handles that indicates the tip diameter of the instrument, from the smallest to the biggest. A modification instruments. So we have in this group K-flex file, similar to K-file, but made by twisting a rhomboid-shaped blank, alternating blades with acute and obtuse angles, more flexible than K-file, but becomes blunt more quickly. K-file, triangular or square in cross-section, made from wire, which is stainless steel wire, which is twisted to make this file. There is approximately twice the number of spirals on a file than on a reamer of a corresponding size. And K reamers made from triangular blank, number of flutes 1/2 to 1 for millimeter. Reamers have less number of flutes per millimeter than files, but they are more fracture resistant than files. So it looks like a loose spiral and K-file looks like a tight spiral. And here we have alternating blades of a smaller and bigger size so that we can recognize the flexi file. The cutting action of the instruments can be done in either a filing, rasping, or a reaming drilling motion. In a reaming action, the motion is such: penetration, rotation, and retraction. The file tends to set in the dentine more readily than the reamer and must therefore be treated more cautiously. Withdrawing the file cuts away the engaged dentine. In such a situation, instrument can be rotated 1/2 turn before retracting. In a filling motion, the instrument is placed into the canal at the desired length. Pressure is exerted against the canal wall, and while this pressure is maintained, the rake of flutes rasps the wall as the instrument is retracted without rotation. Filing is very efficiently done with headstrom files. So we have K-reamer and K-file acts in reaming, H-file and K-file acts in filing. So we have few more modification of this treatment technique. So we have combination of reaming and filing. Push instrument, then rotate 1/4 and pull it out. Watch winding motion is less aggressive than a quarter turn and pull motion, combination of reaming and filing, because in this motion the instrument tip is not forced into the apical area with each motion, thereby reducing the frequency of instrumental errors. This technique is efficient with K-type instruments, files, and reamers. Watch winding and pull motion. Insert file, then rotate it 30-60 degrees to the right and left, then pull it out. This is the most commonly used method, especially with H files. K-reamers, rarely used or indicated. Disadvantages of reamers include the inflexibility with increasing size, which can result in a wider canal being cut apically, have now been replaced by files. Endodontic reamers cut by being tightly inserted into the canal, twisted clockwise 1/4 to 1/2 turn to engage their blades into the dentine, and then withdrawn. Penetration, rotation, and retraction. The cut is made during retraction. The process is then repeated, penetrating deeper and deeper into the canal. When working length is reached, the next size instrument is used, and so on. And you can see on these pictures variety of K-reamers and magnified view of biggest of big size 30 size of the reamer and geometric symbol triangle. K-files, the cutting action of the file can be affected in either a filing, rasping, or reaming drilling motion. The file has no need to contact all walls simultaneously. For example, the entire length and circumference of large diameter canals can be filled by inserting the instrument to the desired working distance and filing circumferentially around all the walls. Operator gradually increases the size of the file to smooth shape and enlarge canal. The larger the number of the file, the larger the diameter of the working end. And here you see the magnified view of the file of the size 30 and geometric symbol rectangular, and pay attention to the tightness of the flutes on the working end. Headstrong files, more aggressive than K-file, must never be used with a rotary action as apt to fracture. All instruments, endodontic instruments, K-file, H-file, or K-rimmer, they are stored in such plastic boxes, as you can see in this slide. Flutes of the H-file resemble successively set triangles one on another. Positive rake angle, hence it's effective in the direction of instrument removing. Fragile and lack flexibility, hence they are only used in straight canals. Headstrong files cut in one direction only, retraction. And pay attention, a magnified view of the Headstrong file, geometric symbol is circle, and magnification of the working end looks like a triangles one on another. Another instruments that considers to be used both in hand motion and rotary motion. So pro-taper files means progressively taper. Their variable taper and advanced flute design offer efficiency to achieve consistent shaping even in calcified canals. They are easy to use, only one instrument sequence, whatever the canal shape. Color-coded and easy to follow protocol. They are drying and obturation solutions specifically designed for pro-taper files with the same color codes for instant identification. They are fast, only 3 instruments needed for most cases. They have high cutting power and they are efficient. Apical taper for good canal cleaning. Fantastic debris removal due to the unique multiple taper design of these instruments. And you can see these pictures of hand pro-taper files and rotary pro-taper files. Instruments for obturation. It is another group of endodontic instruments. Apical obturation instruments are designed to help clinicians pack gutta percha or MTA material or other root sealing materials into shaped and cleaned root canals. These instruments can either be a hand instrument used to physically place and pack the material, or as a syringe designed to place materials in the canal by pushing on the plunger. Rotary instruments. Lentulo spiral filler and rotary paste filler. Function and features of this instrument. It is a small flexible instrument used to place materials into the canal. It fits into the conventional handpiece. The use of this instrument should be with caution as it can be easily broken, and different sizes of this instrument is available, as you can see on this picture. Behind color rings on the color rings on the handles indicates that this instrument is available in different sizes according to International Standard Organization. Pay attention to the magnification of the working end, like a loose spiral. Finger spreader. So the function of this instrument to condense gutta percha into the canal during obturation. Finger instrument with a smooth, pointed, tapered working end. It is disposed in a sharps container, and it can be a hand instrument type, like a lateral condenser. And pay attention, this is working end of the instrument and handle, and magnification of the working end of the finger spreader. Endodontic plugger. Working end of this instrument is flat to facilitate plugging or condensing the gutta percha after the excess has been removed by melting off with a heated instrument. It is available in different sizes of working ends, and it can be designed as hand instrument or finger instrument. So here we have hand instrument and finger plugger instrument. Dental units. A dental unit is a necessary work tool of every dental professional. This dental unit consists of specific parts that include the dental chair, stool, lighting, hydraulic box, aspiration, cuspidor, and other elements that we'll explain below. So dental unit is over here, and every part of it is highlighted by this number, and the numbers are described on that part of the slide. So dental unit has headrest, yes, over here, and the dental chair in general. Yes, so this is dental chair, the headrest. Handrest over here, yes, and assistance console, dentist console with instruments, light, spit and bowl, pedal to drive hand pieces, and what else do we have? Imaging system for diagnosing, and the rest, if necessary, you can read by your own, carefully looking at this presentation slide, and we move ahead. In a simple manner, dental unit could be described in this way. So every dental unit should have chair for the patient, spit and bowl, pedal to drive the rotary instruments, set of instruments for dentist, and table for hand instruments, set of dental assistance instruments. Spit and bowl is a container that is placed next to the dental chair so that you can rinse and salivate during the process. In this case, the cuspidor cup is made with porcelain. It is removable and autoclavable. To this, we add that the tap is removable so that it can be cleaned in a much simpler way. Aspiration system. The aspirator is a small tube used to suction the saliva that accumulates in the mouth or small particles of the cavity. Both the aspiration system and the cuspidor are placed to the left of the chair in the case of right-handed and vice versa if left-handed operator. If you are interested in ambidextrous and left-handed dental equipment, you can find the options available in the article that is in the list of references to this lecture. Instrument tray or table. The instrument tray is one of the most necessary and useful tools for every professional. The instrument tray holds all needed instruments for the dentist to work with. The way of working of each professional is different. There are professionals who prefer the continental system or whip, others who prefer hanging. Dental unit lamp. A 500 lux light level is in a dental clinic, and 1000 lux light level in a medical examination and treatment rooms is required. 1000 lux light level on operation chair is recommended. In these areas, generally used white light sources with 3500 Kelvin, 4500 Kelvin color temperature range. So a dental unit lamp. And this photo gives you information about light position for maxilla and mandible arches. How is a dental unit cleaned? Helping the dentist with procedures is only one part of the job. Another function of the job of the nurse is to sterilize the dental instruments and chairs in between appointments. Equipment disinfection in the dental practice is essential. As said before, non-sterilizable and non-replaceable equipment must be disinfected by using an alcohol-based disinfectant, spray or solution, and wiped by following a wet-dry procedure. Wipe with a moist disposable cloth, wait and then dry with another disposable cloth. In conclusion, even though a dental assistant is an essential member of the office support staff, they have a level of responsibility and skill that goes far beyond support positions in other types of offices. Most dental procedures are complex enough that a single pair of hands cannot properly do the job. So the dental assistant is the figurative right hand person that the dentist cannot function without. To know dental instruments, names, and functions is essential in dental assistant job. And references that would be supportive for your further reading for go in deep into this topic. So you can use these links to enrich yourself with information related to the dental instruments and equipment. Thank you for the lecture and have a good day.